Hello everyone, I'm Jon Salmanton-García from the University Hospital of Cologne in Germany, and today I will speak you about EPICOVIDEHA, the registry for COVID-19 patients with baseline hematological malignancies. Livio Pagano is the principal investigator and I am the project manager. The reason for setting up this registry were three. The first one is that patients with baseline hematological malignancies are at a higher risk for COVID-19 infection. The second one is that these patients, the ones with hematological malignancies, are prevalent in the 2 or 3% of the total number of COVID-19 cases. And the third one is that cooperation between institutions is really necessary to obtain meaningful results. Our main objective was to describe the epidemiology and the outcomes of patients with baseline hematological malignancies and SARS-CoV-2 infection. And these are our inclusion and exclusion criteria. For inclusion, we look for patients over 16 years old of age with active malignancies at any status. It doesn't matter whether they are at onset, they are on watch and wait, or with a progression status. And they need to have a positive SARS-CoV-2 test, either PCR or antigen test. We cannot include patients with non-malignant hematological diseases or with solid tumors, patients not tested positive for SARS-CoV-2, I mean, these patients with only clinical diagnosis, and also patients with off therapy for more than 5 years. We collect different information, which basically can be summarized as you can see in the screen. Identification details from the contributors, demographic details from the patients, underlying diseases, hematological malignancy details, COVID-19 infection information, and outcome of the patient. So far, in 2 years, we have collected more than 7,000 cases from more than 150 centers in more than 40 countries all around the world. And which are the benefits of participating in EPICOVIDEHA? The first one is that you can collaborate and be member of the largest network of COVID-19 patients with baseline hematological malignancies. As I mentioned before, currently there are more than 7,000 patients already registered. The second one is that we grant all our participants with authorship or collaboratorship for every publication whenever their cases are included into analysis. And the last one is that there is the option for you to lead your own research with all the EPICOVIDEHA patients. These are our current publications, a total of 9 so far, and the oncoming ones. So in case you have any of these patients, feel free to contact us and to contribute. You can do it either via email or via Twitter. Thank you very much and see you next time.